Hey everybody, this is Dr. Ben Pearl with FitFoot Youth. So today I have a little surprise. We have a surprise patient today that had a little soccer injury this morning. Me. Here's what's going to happen. I've got a little bit of swelling to the point that I'm limping. It's a Sunday, so I came into the office on my own. I have to say, if my Bills were on today, they're playing Monday Night Football. I don't know. I might have waited till Monday. But it is hurting. I did ice it a little bit before. Probably not the ideal combo treatment you would want to do, but it did make it feel better. It's ice is for swelling. In this particular treatment, we're actually trying to recruit a little bit of blood flow to the area. It's called electromagnetic pulse therapy, and this is basically what the machine looks like. And we're going to take a quick look at my foot here. You can see maybe there's a little bit of swelling. It's in the midfoot area. So without further ado, I'm going to get this treatment started. It's going to be a 15-minute. We're not going to have the full benefit of all the white noise that this treatment has, but I will point out one little thing that I'm going to do today that's a little different than the typical treatment that I normally do. So I'm going to line up my foot and get a little closer to where the target area is. Got it lined up here. And what I'm going to do in a moment, after I get it a little more optimum, I like to get it a little bit closer. What I'm going to do momentarily is do the super transduction pulse segment of this treatment. And that just gives a little extra boost to the treatment. I can tell you right now, I'm feeling minimal. I did this on my knee, by the way, after soccer when it was a little sore, but the problem with that treatment, at least in terms of getting any data out of it, was that I was already feeling a little bit better by Tuesday when I finally had a chance to render the treatment on myself. Right now, again, I'm feeling minimal in terms of any kind of static sensation that I sometimes will feel. I've got to do a small adjustment on the thing. So I'm trying to wear a lot of hats for a moment, but I'm going to adjust it here just so I can get a little bit closer. I got to adjust it so it's a little more lateral word on my foot. And I'm actually going to rotate my foot so I can get it up into the optimum segment there. Now, couple things about these treatments. They are not considered one and done. One and done is what we used to think of with shockwave. Shockwave is a procedure that we used to bring people to the hospital, anesthetize them, and use a different type of energy, literally shockwaves, to elicit a healing response, kind of a micro trauma. What's nice about this one is even though we're recruiting blood and also upregulating cytokines to the area, which are anti-inflammatories, it's a gentle treatment. So it's not as if I'm going to do this and have anything more than minor irritation. Right now, I'm kind of feeling a little bit of almost like a vibratory kind of sensation. I wouldn't quite call it staticky just right yet. In a moment, I'm going to convert over to the super transduction. By the way, when you leave it and let it for a while, it almost feels with the inner vibration of the tissue, it's like a gentle massage inside the joint, if there could be such a thing, almost like a tuning fork inside your joint and inside the muscles. Now I'm feeling at this particular pulse like almost like a little spider dancing on my lateral side of my foot. Speaking of spider and self-treatment, I have to mention and invoke different sort of self-treatments gone awry. We've seen them from Dr. Frankenstein with Mary Shelley to Dr. Octopus of the Spider-Man world. But this one, unlike those more fictional hyperbolic treatments, is a very sort of limited treatment. Even with the super transduction pulsing, we're not expecting like huge bullets of energy. Although, what I will say is this is much more energy than there would be expected if you were to do some type of bone stimulator unit, which requires more time. Those are small powered devices by battery, so you're only going to generate but so much energy out of one of those units. The nice thing about this one is we have the benefit of 0.4 Tesla. So I'm going to take a moment now to go up to the super transduction pulsing, just to comment and see if I feel any difference. This thing is self-supportive, so I can just cruise over here and hit this increased button here to get the higher amplitude. Let's just make sure we're in that pulse wave. I might have to pause it to do so. There we go. Yeah, you have to pause it to do so. Now I'm in the super transduction. Sounds different, doesn't it? So let's see what that does. And so far, not feeling much on the initial. You can hear it, it's at a different frequency. It's getting warmer. I almost feel like more warmth, less vibration, and it feels more coned to my sensation to a point. So I'm certainly going to be reading a little bit more about this pulsing. Right now, this type technology is very much on the new horizons. So the protocols are literally being established by the docs. There are some studies that have already been done with other units. This is an analogous unit, meaning they've used the same technology, just repackaged it in a slightly different box with slightly different Tesla. And I'm not getting into a brand wars thing here for the purposes of this segment. Just suffice to say that this technology in this current configuration has been studied. The difference being 0.4 versus 0.6 Tesla with some of the published work, which I think is trying to compare like a 80 points wine from Napa Valley to a 90 from the coast of Oregon. So, you know, it's all good energy for healing. That's the main point. And I'm anxious to see after a couple treatments how I do. Till next time, this is Dr. Ben Pearl with FitFoot U. We'll have an update in a week or two.